G'day, I'm Will.
Hello, I'm Michael.
Nice to meet you. That's all right, take a seat.
Thanks for seeing me.
That's all right, Michael. What brings you to me today?
I have shoulder pain,
Yeah.
restriction in movement.
Okay, no worries. Is that a referral from your doctor?
That's my referral, thanks.
No troubles, that's right. Do you mind if I take a look?
Sure.
Okay, so it says that from the doctor, this referral states that you have a subacromial shoulder impingement. Is it in your left or right shoulder?
It's my left shoulder.
Okay, nice. Do you know what a subacromial impingement is? Would you like me to explain a bit? No, that's all right. Normally the doctor would explain it a bit, but I'll give you a bit more of a further explanation. So basically an impingement occurs when the subacromial space within your shoulder becomes narrowed. So once that becomes narrowed, the shoulder tissue then becomes compressed, giving you pain. In layman terms, pretty much you have shoulder pain, like you said, which is caused by the connective tissue rubbing on your shoulder blade. Okay, so which is that bone at the back there.
Yep.
Nice. So basically that's it.
Okay.
You'll have two types of impingements. I think it said from your paperwork that you have a type 2 impingement. So type 1 is a very minor impingement, can often be treated with basic rest, ice, compression, or non-steroidal anti-inflammatory drugs. Mm-hmm. However, with your type 2 impingement, it requires a bit more of a treatment. So the type 2 treatment often results in physical therapy, which is why you come to see me, an exercise physiologist. And we'll try and do our best using exercise interventions to get your shoulder back to its full strength and flexibility.
Yep.
So that's the main thing. So we'll do this through basic strength exercises, some isometric stretching, concentric and eccentric contractions. We'll see how it all goes.
Yep.
If we can't help to relieve your pain, maybe it might require some surgery, but we'll give our exercise a go first, and we'll go from there.
Cool.
That's all right?
Yeah.
So, tell me about yourself a bit. What sort of brought you to me today, besides the referral from the doctor?
Well, like I said, the pain, it's quite restrictive. Pain goes down my back a bit. When it's there, it's restrictive in movement. I'm a builder. I have quite a physical job.
Yep,
So
definitely.
it's just restrictive in my work.
Yeah,
generally. Yeah.
So you're lifting majority of the day?
Yeah, lifting, carrying, pushing, pulling.
Okay, so using your shoulder quite a lot.
Yeah.
Okay, that's good. And do you have any other past medical history regarding your shoulder or rest of your body?
Yeah, fair bit. I've had frozen shoulder on this side, broken wrist, problems with knees and fingers, and other broken bones. So,
Okay,
yeah.
So you've hurt yourself a few times. That's all right. And your other shoulder, was that the same subacromial impingement?
Frozen shoulder.
Okay, so something a little bit different.
Yeah.
Did you have to have surgery on it that time?
No, it just sort of got better after a couple of years with some movement and exercise and bits and pieces, yeah.
Okay.
Can't really tell you.
Well, hopefully we can do the same thing for the other shoulder this time.
Yeah.
That's all right. So your general health, usually quite
quite fit.
Active?
So I go to the gym, quite active, and regularly go to the gym. And just at work, I'm quite active and physical with that.
It's quite a physical job, being a builder, definitely. Yeah. That's right.
So no, general health, other than my injuries, I'm pretty good.
That's right. Oh, very good. And you don't take any medications at the moment?
No, some Panadol, some anti-inflammatories occasionally, but generally pretty good.
For your shoulder or for other?
Oh, probably for a few things,
Yeah.
My wrist or my shoulder and a few things. So,
yeah, definitely, that's
so
right.
I've certainly come to see you about my shoulder today.
Yeah, it seems to be like the main concern for you, that's all.
Yeah.
Has there been any changes recently in your health, age? Obviously, we get older each year.
Yeah, nothing's really changed dramatically like that.
No, that's all right. No worries. No increased workload. Nothing stressing you out at home or work.
Oh, there's always stress. There's always work, but that's
normal.
That's good. Yeah.
Yeah. Fair enough. That's all right. So, tell me a bit about your pain. It's your left shoulder that you're saying is the pain? How bad is it out of 10?
Well, sometimes it's quite acute.
Yeah.
It hurts quite a lot.
Right now, just sitting here like this.
Sitting here, it's only 2.
Only 2?
Yeah. When I go, there's a restricted in movement, height, different things like that. And then sometimes it'll be quite sharp and very quite tight.
Okay.
Yeah.
And does it? So it's more movement which aggravates it.
Well, yeah, if I sit here and don't do anything,
Yeah.
yes, that's
Okay.
exactly right.
When you
but
move,
it's only very low pain.
Yeah.
It's not
it's like a dull ache.
Yeah.
And how would you describe it? Is it like a sharp stabbing pain when it comes?
Generally.
Yep.
Mm.
And what's the movement that hurts it the most? Is it the raising of it, or is it
It can
moving
be
around?
multiple things. Could be the raising of it. It could be a tension or pulling or pushing or something like that. Just seems to go, oh,
Hurts straight away.
Yeah. Inflame it.
And the pull, where does it radiate? Does it stay within that shoulder area, or are you saying that down the
No,
top
it
of the
goes
back?
down my back as well.
Okay, no worries. And does that stop you from walking ever? Like, or does it just stop you from the movement of your shoulder?
Just restricts you in the movement. Doesn't stop me from walking or doing anything else. It just restricts me at work and other activities as well.
And does it return back to normal on its own, or do you have to require taking like Nurofen or
I have to
icing it?
Yeah, generally pain relief. Yeah.
Okay, no worries.
Especially when it's had that acute.
Yeah, some impingement. That's all right. No worries. Well, now I know a bit about your pain. What we might do is talk about trying to. What are your goals to try and get rid of this pain?
To relieve the pain.
Just to get rid of the pain.
Yeah.
That's right. And that's what you'd like to achieve out of come and see me, obviously. Yeah.
Full range of movement back into it. Normal strength.
Yeah.
And action.
Yeah, definitely. Yeah. So there's a few good goals there that we'd like to try and achieve, which is good. I think through us working together, we can definitely try and achieve that. What we were trying to do in the research that I've read on the subacromial impingements, best results to decreasing the pain, increasing the movement, and returning it back to normal without the use of surgery is through some basic strength, eccentric and concentric contractions. So what we'll do is we'll make some specific and SMART goals right now. So specifically, you'd like to, in the short term, decrease the pain in your shoulder, obviously. Yeah. That's the main goal that you're trying to achieve.
Well, yeah, pain and I think that'll the movement.
So pain and movement in the short term. Yeah. So over the next 6 months, we'd like to decrease the pain and the movement, and increase the movement again of the shoulder.
Yeah.
Yep. Definitely. That's right. Well, doing that, what we'll do is together in our next couple of sessions, we'll help to develop a program together, strength training and flexibility program together.
Yep.
We'll go through it within the clinic here, and then I'll give you the program to take home, so you can work on it at home whilst you're not with me. And then when you come back in here, we'll reassess your range of movement, and we'll make modifications to it accordingly.
Right. Yeah.
So as your strength will improve, we will therefore increase the strength. And as your flexibility improves, we'll change the stretches to try and compensate for that.
Right. Yep.
So that's how we'll do it. There's no massage involved. We're going to try and stick to the exercise base. That's the main research that we found. Mm-hmm. And we'll go from there, and hopefully that'll help to improve everything for you.
Right, yeah. So some exercises here and then some at home.
Yeah, certainly. So the combination of both. Yep. We won't be able to achieve the full pain relief without you working on it at home. It's like giving you a little bit of homework to do at home sometimes.
Sure. Yeah, that's good.
Yeah.
Good, happy for that.
Do you have any questions for me at all?
No, I think you've covered most of it.
Yeah, that's right.
Pretty well. So,
if you do have any questions, feel free to give me a call. You have my email and my phone number now, so that next session we'll go through. We'll assess your range of movement.
You don't want to see it now?
Right now, no, not now. So we're just going to observe it today.
Yep.
Next session, what I'll do is I'll take a look at your full range of movement.
Yep. We'll
do a few specific tests, the near test and hip test, and that'll assess the full range of movement and your strength of it all. What we'll go through, we'll look at your strength, your 1RMs, all of that, just to take a look at, see what level you're at and where we're going to try and to improve from.
Right.
So that'll be our main goals, trying to relieve the pain and the movement in the short term, and in the long term, over the next year, together, we'll try and improve your strength to where you're at prior to this impingement.
Right.
How does that sound?
Sounds tremendous.
Yeah, nice. All right, well, thank you for today, Michael.
Thank you, William.
Pleasure to meet you. We'll see you next time.
Thank you.